Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Holly MacKenna. She's an integrative psychiatrist. Her Kevin MD article is titled Balancing the Roles of Patient and Healer. Holly, welcome to the show.
Hi, thanks so much for having me.
So we'll get into the article in a little bit, but first off, just briefly share your story and journey to where you are today.
Yeah, I'm an integrative psychiatrist, as you mentioned. I started practicing traditional psychiatry about 20 years ago. I think I was looking back probably about 10 years ago or so. I started integrating more of a mind-body practice with meditation. I had studied dialectical behavior therapy, which is very mindfulness-based. And then things kind of evolved. I went to a leadership program at Duke University that taught the business side of integrative medicine. Met some healers there who had completed Andrew Weil's program, who encouraged me to do the same. So I entered into his fellowship, became board certified in integrative medicine as well. And so now I have my own private practice out of New Orleans. I also do telemedicine. I focus primarily on folks with trauma and also traumatic brain injury, because a lot of the folks dealing with that have a difficult time with traditional medication. And so I'm able to offer traditional medicine, but also supplements, mind-body work. I'm certified in Reiki and auricular acupuncture, so I can kind of do a whole person approach.
So take us into your office and walk us through some of these integrative techniques that you would use, some typical cases that you would see, and just give us a sense of how your practice differs from a traditional psychiatry practice.
Yeah, I was trained by analysts. So I think early in my training, I learned that a good interview is really the basis of excellent work. And so I actually do up to 2 hours to evaluate a person. I do, what you might expect a psychiatrist to ask as far as history, medications, but I also get into what their exercise practice is. Do they have a spirituality practice, a mindfulness practice? Are they on supplements? People are usually taking supplements, but they don't tell their physicians about it. And not all supplements are good supplements. And then also what their diet is like. Gut health, we're learning more and more, has a lot to do with brain health, that connection. A lot of the serotonin is made in the gut, melatonin, all the things that we really need for a healthy brain. And so we talk about all those things. Then I do a pretty thorough feedback session going through all those different areas and recommendations. And I've come to realize, being on the patient side, that can be quite overwhelming. So I try to break it down as to like where we can start and let them know this is what we're going to be following over the coming months, but not something they need to do all at once, because it's a lot. And then, depending on the person's needs, some folks come for therapy. I do have a membership program to help people be able to engage in all the things in a way that is more economically friendly, because I do like to have that integrative practice, but I also understand not everyone is going to be able to pay for all the things. So instead they pay a monthly fee, and that includes Reiki, that includes acupuncture, includes coaching, and that way they can engage as much as they need, and there's different levels. And some folks just do a basic membership where they don't see me as a patient, but they still get all the education and bells and whistles outside of that.
Now, what are some common conditions that people come see you for?
A lot of folks will see me with brain injuries. I have an association with Tulane Center for Brain Health, where I see former NFL players and veterans with traumatic brain injury. And I think the word got out. So a lot of folks who maybe have had a car accident or a sports injury and haven't felt the same sense will seek me out for that. And I see folks nationwide for that. Then I also have a lot of folks with bipolar who do need to be on a traditional medicine. They do need that mood stabilizer. But I found with different supplements, we can maybe help them manage it in a way that we don't have to get on the maximum dose of drugs, where, bipolar folks, they don't like feeling that drugged out feeling. The mania or hypomania really is kind of fun. It can be kind of helpful for people. So it's that balance of getting to more of the euthymia, the not so hypomanic, but not feeling so dulled that their creativity isn't something they can tune into, or things that, are often common complaints of our bipolar patients. Also, a lot of women with polycystic ovaries or fertility problems, because I do that whole person approach. So I'm able to work with their fertility physician or their primary care doctor and make recommendations that are going to help not just what you would think a psychiatrist would address, but also their ovarian health, their weight, what have you.
So Tell us a success story. You mentioned that you're a nationwide expert when it comes to traumatic brain injury. So tell us a success story where your approach moved the needle in one of these patients.
Yeah, I actually had a college student that reached out who was, she had been doing well in one of the local universities, but had a car accident and noticed from then on that she wasn't able to focus. She had a lot of anxiety that had come up, a lot of mood dysregulation. And these are things that we see with a brain injury. Every brain injury is different. It's not like this is the absolute, this is what it's going to look like, this is how we have to treat it. But in her case, it was a one-time injury, and she was just having difficulty not only staying focused, but again, kind of getting out there, enjoying her college life. The anxiety was kind of taking over. The mood dysregulation was taking over. She had a great family, a loving relationship, but she had been given just like your typical antidepressants, maybe a stimulant at one point, but none of those things really worked. Because brain injuries affect not only how you're feeling and thinking, but it can also affect how your brain responds to medication. She really had a lot of side effects for medicines, and that's a common complaint I see with folks with TBI. So we were able to lower the medication, use some micronutrients, which is basically all the vitamins and minerals that you would need to make the neurotransmitters in your brain. Sometimes that works for the folks in Arizona where I studied for my fellowship, use those a lot and are big fans of that. And there's actually lots of studies coming out from Canada and different areas about the use of those. So we're able to use that to lower her medications, allow her to still have some focus. And then I added supplements. I added supplements for chronic stress. When we have a trauma like a TBI, it is like a PTSD, but oftentimes you don't remember what we call the criterion A stressor, the stressor that really causes the PTSD. And that adds stress in itself. We're having the symptoms, but you don't remember why necessarily. So adding what we call adaptogens, those types of supplements can help lower that fight or flight tendency and allow your body to respond to stress more normally. So sometimes doing that with some other supplements, I added some that help with anxiety, help with obsessive compulsive thinking, which is what she was experiencing. With time, she told me, Doc, when I do all the things you tell me, when I take the supplements you recommend, when I do these breathing exercises, I actually feel like I did before the accident, which to me was just like, it was like, the archangels were all singing. I'm like, this is why I'm doing what I'm doing, is to help folks like this. I treat folks that also have a number of injuries, like my veterans. And for them, it's a stepwise process. It's not going to be something overnight. And it's a team process. I work a lot with physical therapists, speech therapists. I can't say enough about the ancillary services that are going to help really with the whole person, because I am only one person. I'm not a magician, but I do like working with that team approach and offering what I can to help the person think and feel more like what their normal should be.
All right, let's shift gears and talk about your Kevin MD article titled Balancing the Roles of Patient and Healer. Now, how did this article come together?
I have been dealing with chronic illness myself since, actually looking back, probably high school. I started having issues with fatigue, palpitations. I was a teenager, kind of living my best life. And next thing you know, I'm going in and out of doctor's offices, getting my heart evaluated, getting lots of labs done. And at the time, they only found a heart murmur. I think they probably rolled their eyes and were like, oh, overreactive teenager, which, had I not had the experiences I had, I wouldn't blame them. Then I went into college and was doing okay until my senior year, which is where all the stress was done. I was in medical school. I was kind of in a good place. And I started experiencing a lot of sinus infections, kidney failure, the whole 9 yards. Fast forward, I actually ended up having to take a year off of medical school because, again, this kind of ebbing and flowing of illness kept happening. With time, I decided this is something I'm just never going to know what it is. My rheumatologist said it's an undifferentiated connective tissue disorder, and I kind of decided, well, that's what it is. I now have a 10-year-old daughter. I have 2 children. They're both rainbow babies because I've had multiple miscarriages, which is part of what's been going on with me. And she, at age 8, started falling asleep over her homework. This was during the pandemic, but her school had actually gone back to face-to-face. She was doing the exact same thing she'd done the year before. So part of me was like, am I overreacting? Because I was in a fellowship at the time. I'm like, am I kind of going to the extremes of what I'm learning in fellowship? Or is this just stress? This could just be stress. So this is why I choose the doctors I do. I always choose doctors for myself and my family that I trust, because I don't want to treat my family or myself, try to get that out of my brain. So I went to the pediatrician. I said, listen, I could be overreacting, but do you mind kind of maybe taking a look at her? She's falling asleep over homework. She admitted to my friend who cuts her hair that she was pulling her hair out. She was getting super anxious, really tearful. She wasn't herself. So we started doing some labs. I have a family history of autoimmunity. My parents are both from Ireland. It's a very small country. As I joke, it's very inbred because it's a very small area. Mm-hmm. So, we have a long history of autoimmunity in my family. And she had some labs that suggested that, a positive ANA. She ended up seeing rheumatology, every rheumatologist's nightmare, positive ANA. That's the complaint. They did some more labs, saw that she had some autoimmune indicators for her thyroid, but her thyroid tests were normal. They actually suggested waiting until the thyroid was not normal. And this is where I put on the doctor's hat and I was like, I'm not okay with that. She's miserable. I'd also reached out to a friend who is now very successful pharmacist with NASA, who during high school, I remember, had thyroid issues. And she told me, Holly, I didn't realize until I was on the thyroid medicine how miserable I was without it. So that really kind of drove me also to reach back out to the pediatrician. He fortunately agreed, and we got in with the endocrinologist who got her on Synthroid. It was like night and day. She started growing because she was always kind of a shorter kid. She started feeling a lot better. And then more recently, she had to step back again. And it turned out she had some nodules on her thyroid, which I write about in my article, just to kind of give a little bit of, for those who have read the article or reading it, they've turned out to be benign, fortunately. So we're monitoring those. And at the same time, partly because of what was happening with her, and partly because I have a colleague who works in Tulane's hypermobility clinic who kept poking, I realized that maybe there was more happening with me than I had realized. And so I also kind of re-entered that journey, which I didn't realize my defenses had really kept me from doing for, 20 something years. And I've since gotten a diagnosis of Ehlers-Danlos for myself. So we're both kind of re-entering into that phase of the system and dealing with it as a chronic patient.
So what's it like entering that system as a chronic patient, as well as being a physician as well?
It's actually, I was surprised by how emotional I got. I remember early in the process, before I saw the doctor, they have a 600-person waiting list because this is a nationally known clinic. So they have a lot of kind of pre-work that you do before you see the physician. And one of them was just getting a lot of imaging done. And they had said, we don't know if your imaging is going to be covered by insurance. And I'm now on my husband's insurance, which, isn't as great as when I had worked for the VA previously. I had insurance I didn't have to worry about. So I found myself trying to figure out, is this covered? Do I need to go to a different place for the imaging? And trying to navigate that, I found myself getting super tearful, super anxious, just all the feelings coming up, feelings that I really had buried for decades. Of, maybe I'm full of it, all the things that I had been told or interpreted as being told to me as a young adult. Maybe I'm just a whiner, maybe like this isn't anything, like why am I bothering? A lot of self-doubt, a lot of just anxiety and upset. And really the driving force for me to keep going is my daughter and my children. It turns out this diagnosis is autosomal dominant. So it's something that, I do need to know about to kind of let my family know about. And family is an important thing from, in my culture. It's very much about family. And so doing that for not only for my kids, but also for my ancestral line. I look back, my grandmother had multiple miscarriages that she, were upsetting for her. My dad had issues before he passed away, and just getting answers even for them is what kept me going. But it was definitely, a time of kind of looking at my own dark side and things that maybe I hadn't dealt with, which, is interesting as a physician, because, that's, as a psychiatrist, I'm helping others do that all the time, but it was really a physician heal thyself moment.
Now, any lessons that you've learned being a patient in the system that you could apply in the exam room or your office as a psychiatrist?
Yes, I mean, one was, as I mentioned, that it can be overwhelming. I try to be so thorough, just I think because I have been on the side of seeking answers. And I know from my traumatic brain injury folks, oftentimes they don't know what's going on because it's another diagnosis that people are kind of learning more about. And, this research is still happening on. So I understand that feeling of, if I just had an answer, a lot of this anxiety would go away. And that's true. Like, having that diagnosis, I cried when the doctor told me, and he's like, "Are you okay?" I'm like, this is like cortisol coming down into my science brain. This is tears of relief. Like, this is 20 something years of unknown and of not feeling seen, like finally coming out. So knowing that sometimes that's what people truly need. So when they're asking for a diagnosis, sometimes it's easy for us to get judgy about it. And, I worked in the VA system for a decade, and sometimes there you get a little burned out and think like, oh, they just want service connection and benefits. But sometimes no, they just want the answer. They just want to know, why do I feel this way? And then having that space to talk about it. When I finally did see the doctor, he just let me talk. He was doing his exam, but he didn't interrupt me as I just processed all the things and stuff that was coming up from, 20 years before, and things that had happened and situations. And, hey, is this because of that? And, it probably, maybe not to him because he's dealt with it, but to me, it felt very scattered the way it was coming out. But allowing space for that, I think just giving people time to talk and feel heard, there's so much value in that. And it doesn't have to be a long time. I don't think I necessarily had the longest visit, but it felt long because he gave me that space. And I mean, that's why we got into healing. It's just that the big system, organizational medicine, has kind of gotten in the way of that. But I think that's where the beauty, the magic of medicine is.
So as you know, I'm in primary care, and time is at a premium. Sometimes we have like 10 to 15 minutes with these really overwhelmingly complex patients. So what are some techniques that you can suggest in order to give patients space so they can tell their stories? Any tips that you could share from your experience as a psychiatrist as well as a patient as well?
Even just 5 minutes. Like, you have this podcast that's a brief podcast, but it's full of juicy tidbits. I love listening to it. And I think it's a perfect example of how you can really get a lot out of just a small period of time. So if you and this is something I remember an old professor saying to me way back when, but now that I'm on the patient side, it comes back to me, is just give them those 5 minutes to tell their story, and then get into the, you can be kind of making notes to yourself as they're talking, but definitely give them the visual feedback of listening. But, we're multitaskers, our brain can still be going, but just allowing them that space. Or if you're doing a physical exam, that's how my doctor did it. He was doing all the parts that kind of indicated the Ehlers-Danlos and telling his assistant, like, yep, this is, scapula, this and all that, while I'm going on. Just letting me talk. So it might just be that you, in a way, kind of let it happen while you're doing something else. You're listening, you're checking their bowel, doing things that maybe they can still be talking during, and just allowing space for that, allowing that human connection. There's so much power in that.
We're talking to Holly MacKenna. She's an integrative psychiatrist. Her Kevin MD article is titled Balancing the Roles of Patient and Healer. Holly, what are some of your take-home messages that you want readers to come away with after listening to you today and reading your story?
I think allowing yourself to partner with your patient, really remembering, especially those of us who are in healthcare, what drove you to go into healthcare. As we've kind of touched on, sometimes the big system that is often not run by physicians or healers can get in the way of that, with all the, electronic health record and reminders and all the things we have to do. But really allowing yourself space, whether it be taking a few breaths between patients so that you can then be present with them in that moment, or, as we've said, just giving them a few minutes to talk. I think that connection not only serves the patient, but it serves us as physicians and providers because it feeds our souls. It reminds us why we do what we do. That's so healing for everyone in the room, us included.
Holly, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
Thank you for having me. I appreciate it.